Hi, everyone. Welcome to Arthritis at Home. I'm Cheryl Koehn. I'm with Arthritis Consumer Experts. We host this program, and it is really an honor and a pleasure to be here today with Dr. Kamran Shojania, a rheumatologist in Vancouver, British Columbia. Welcome.
Thank you, and thank you for inviting me. It's a pleasure to be here.
Yeah, great. Let me tell the audience a little bit about you, Dr. Shojania. So you're a clinical professor at the University of British Columbia. I don't want to make you sound old, but you've been in medicine for a long time. Although you look very youthful, you are not a newbie. You have practiced in internal medicine. You have a huge teaching pedigree behind you, lots of awards. You've been in rheumatology for years and years, have volunteered at leadership levels within the Canadian Rheumatology Association. And so you know this topic incredibly well. You followed thousands of patients over the years with rheumatoid arthritis. And you're also obviously the medical director of the Mary Pack Arthritis Program for the province of British Columbia. So welcome again. We're so happy to have you with us today. And we're going to talk about something that probably doesn't get enough airtime, Dr. Shojania, and that's smoking and rheumatoid arthritis. Tell us about some of the changes you've seen in research, or some of the sort of old research, some of the more recent research on smoking and rheumatoid arthritis.
When I was training in the 90s, this was not something we thought about or talked about. It was this millennium and maybe in the 2010s that we started to think about clinically about smoking and its link to rheumatoid arthritis. And also, what's the cause of rheumatoid arthritis, Cheryl? Like, you know,
please tell us, we're dying to know.
Okay. Well, a lot of people think the trigger, the antigen trigger, starts in the lungs. Yes, so it's interesting, and is it an infection or something? But really, and the lung doctors tell us it's always the lungs, and smoking, its effect on the lungs. We know that people with rheumatoid arthritis have a very high incidence of pulmonary complications or lung complications. So one of the first studies that I remember was from Winnipeg, actually, that showed that smoking was a risk factor for rheumatoid arthritis, particularly in First Nations. And it went from there for me personally. And my interest, Cheryl, I think you know, over the years, I've been really thinking about what we can do non-medication wise to help us with our rheumatoid arthritis or other autoimmune diseases. So, and really the research now is telling us that lifestyle measures are so important in rheumatoid arthritis, psoriatic arthritis, and these things are, for example, exercise, very important, smoking cessation, very important, and weight management. So obesity increases rheumatoid arthritis and psoriatic arthritis risks as well. So anyway, I'm going wide here, but what I'm trying to say is that this is more of a recent phenomenon that we're looking at these lifestyle measures like smoking.
Yeah, and you know, when you talk about these other lifestyle measures, Dr. Shojania, one of the things, as you know, I live with rheumatoid arthritis. I have for the last 33 years. And when you're diagnosed, you get this incredible sense of loss of control over your life. And one of the things I really enjoy listening to you and others in the medical profession when they talk about stopping smoking or, you know, starting or maintaining exercises, those are things, for the most part, I can control myself. And it gives the person back some of that, you know, that sense of loss of control. So I love that you went wide here right at the start of our conversation, because everything is connected. And smoking, I didn't know about this origin of RA possibly being something that's triggered within the lung environments. I know that you're familiar with this new research that I mentioned at the start of our conversation. It's going to be published in Arthritis Care and Research, which is the American College of Rheumatology's sort of one of their premier journals. And it was a study conducted in Sweden, a very large study, what they call a population-based study. And I wonder if you can share with us just sort of a couple of the key takeaways from this study and why it's gotten a lot of buzz.
It's got a lot of buzz, and for me in particular, because a lot of the earlier studies showed that smoking was important in subtypes of rheumatoid arthritis, high anti-CCP antigen patients, or certain HLA-DR4 type of patient, which is a gene, which we don't measure. But this study says, no, it's actually for everybody with rheumatoid arthritis. So current smoking is associated with increased disease activity and lower health-related quality of life in patients with RA. And more importantly, smoking cessation within the first year after baseline has a favorable effect on disease activity.
Okay.
So those are the two take home. If you don't think about anything else from this study, that it's really for everyone with rheumatoid arthritis.
So in other words, if you're a current smoker and you have rheumatoid arthritis, this research says you can stop at that 1 year mark post-diagnosis.
But we know that smoking has an effect other than disease activity in rheumatoid arthritis. Smoking increases mortality in rheumatoid arthritis much more than rheumatoid arthritis does itself. So, and we know that smoking reduces the effectiveness of medications in rheumatoid arthritis.
Okay.
So I tell my patient, it doesn't matter how long you've had this condition, that smoking cessation will improve your longevity, and your rheumatoid arthritis damage will prevent damage better than if you kept smoking.
Okay. Those are, I mean, for someone like me, I get pretty excited when I hear I'm going to have less pain, I'm going to have less fatigue, and I'm going to possibly live longer. I like all of those outcomes as a result of stopping smoking. Let's talk about how you talk about this with your patients that are living with rheumatoid arthritis. Like, how we know smoking, like many things in life, it's an addiction. And one of the issues or the challenges in addiction is folks often throw up a roadblock. It's difficult. It's an addiction. So it's difficult to quit the addiction. How do you broach the subject, Dr. Shojania? It's a tough conversation to be had, I know.
It's a tough conversation. I have to say, I've learned a lot from the nurses that I work with on how to talk about this, because we were not trained in this when I was in med school or residency. In the old days, it's like, you should stop smoking, scare tactic here. Now you should stop smoking.
Yeah, pictures of rotting out lungs. Yeah.
Yes. How dare you smoke?
Yeah.
And surprise, surprise, that doesn't work so well. And then the doctors get disillusioned, like, oh, I talked to the last 30 people about quitting smoking. No one's quitting. It's not worth it. And that's wrong. So what I've learned from my nurses are that you broach the subject just like anything else. You have to get permission from people. And if you can say, there's a link between smoking and rheumatoid arthritis at some point, and let me take a step back. When you make the diagnosis, maybe it's not the best time to say this.
Yeah, because people are completely overwhelmed, right?
That's right.
Yeah.
But you can say at some point in the next few weeks, we're going to talk about lifestyle measures that may help your arthritis. And they're very excited about that at some point, right? And then when you do talk about it, you can prepare them. Next visit, I'd like to talk to you, if with your permission, I'd like to talk to you about some lifestyle measures that really may play a part in improving your arthritis. Things like weight management and smoking cessation. Are you okay if we discuss that next visit? And they're like, okay. Or you can, in motivational interviewing, I was taught by my nurses that you can say, smoking, cessation of smoking is very important for your rheumatoid arthritis. On a scale of 1 to 10, how open are you about considering smoking cessation? 10 being, I really want to quit smoking. 5 being, I'll think about it. Or 1 being, I love smoking. It's my only friend. I will never quit.
Yeah.
If they say 1, move on.
You're not there yet. Yeah.
If they say 5, that opens the door. Let's okay, let's talk about it. If they're 10, then I show them these, or they're higher than 5, we show them these resources for quitting smoking. Do you see what I mean? So
yeah, I totally do. And, you know, it's interesting. So for myself as an educator and someone who works in this space alongside folks like you in the medical profession, to provide the right information at the right time, written in the right way.
Yeah.
I think, oh my gosh, there's an opportunity to take someone from a 1 to a 5.
That's right.
And one of the biggest barriers in that is simply giving them the information that smoking has a very negative effect. And that negative effect can be reduced if you stop at 1 year, right? That's the key, one of those key findings from this study. So it's the knowledge that you might give to someone or help share with someone that might move them along that continuum.
Funny you said that, because one of the questions we ask after they say 1 is, well, what would it take you to get to a 3 or a 5? And they'll say, well, if you tell me that the smoking is already damaging me, or if someone I knew had cancer, or if someone this, or if the cigarette prices went up, or something like that, or if you gave me more information, and then we offer this.
Yeah. So then we're going to wrap up our conversation here, which I think is going to be very helpful, not just to people with rheumatoid arthritis who are going to tune in to this episode, Dr. Shojania, but probably to some of your colleagues as well. You've delivered some, I think, great clinical pearls here for them to incorporate in their practice. But so I'm your patient. I'm sitting with you here on a video consult. I have RA and I'm smoking. Just in your own way, what would you say to me?
I might say something like, well, it depends on how you were doing at the time. And if you had a few swollen joints and things were not going so well, I'd say, well, there are things we can do. We can adjust the medications, as we've talked about. There are some lifestyle measures that may help, as we've talked about before. Shall we talk about those now? And if you say yes, then I'd say, well, there's some, previously you told me that you were not that interested in quitting smoking. I do have some more information about that if I can share that with you.
Right? Perfect. And that's how you incorporate new research findings, right? That's how you constantly improve your own knowledge and translate it into clinical care.
And I have to say that I work with 2 amazing nurses who will also bring this up in a very nice way and offer some support. And also, getting older myself and having family members who smoke and friends, and I realize that I can bring those experiences into it as well.
Yeah. So changing the world of health one person at a time. I love it, Dr. Shojania. I want to thank you so much for spending this time with us. This is such an important topic, and it's one of the reasons I hounded you to come into the studio with us, because again, it's one of those things that when the time is right for the person with rheumatoid arthritis who is smoking, change can happen. And I think that's just such an important and hopeful message for people who are diagnosed with this disease, especially given we don't know all of the causes of rheumatoid arthritis, though you've certainly given us a good strong hint at one. And we don't have any cures apart from we can make these lifestyle changes that make the disease less impactful, as well as the medications, which are incredible now in rheumatoid arthritis, both in terms of biologics and in targeted small molecules and other types of medications. So I want to thank you so much for joining us. It's always a pleasure to sit with you. You always bring a great body of information to our audience. And we're going to also provide some resources at the end that might help people consider the impacts of smoking in RA and possibly get on the quitting journey, which is very exciting. So quickly recap what we've just been discussing with Dr. Shojania. The research from this large study out of Sweden did report important new findings on smoking in RA. They found that over the 3-year period that people were followed in the study, those that quit at year 1 of the study definitely had less active disease than those who did not. So again, from research of the past added with this new research, we can say definitively there's a direct connection between smoking and the worsening of rheumatoid arthritis. And also the positive side is that a person who smokes with RA can change that by quitting. Remember, for those who were in the study who didn't quit, they had more disease activity and they had lower quality of life, both physical and mental. So given these findings, if you currently smoke and have RA, are you ready to think about quitting? If you are, there are some very practical tips offered here, and there are many more if you check out the resources we provided you on the following slide. But to start, interestingly enough, knowing that smoking is bad for RA is where quitting starts. It's that fundamental information that helps people kind of come to grips with the fact that their smoking addiction is worsening their disease. So knowing that is a baseline to actually going on to quit. Now that you know this information, if you are a smoker and have RA, ask yourself, are you ready to quit? Ask yourself the question, why? Why are you ready? Saying it out loud and writing your goal to quit down on paper will definitely help make it real. That's why journaling is such an important part of living with chronic disease. It helps us focus on the things that are important or the things that we want to change in our lives. Getting behavioral support, which is generally a free service in all Canadian provinces, can help you understand and develop your goals for quitting. Group support can be super helpful, learning from other people's experiences. And I love this saying, teamwork makes the dream work. That support that you get in group settings is really invaluable for a lot of people. And of course, there are quit aids, such as prescription medication and nicotine replacement therapy, gradual reduction therapy, or simply going cold turkey. Here are some important resources for you to access. Here is a provincial and territorial services link. When you click here, it'll take you to a website that then has provincial and territorial links for you to access. If you really want to speak to someone by phone, you can. Here's the toll-free number. And there are specific considerations when we think about smoking in Indigenous populations. Here is a link to the First Nations Health Authority and their website on respecting tobacco. Exciting. So thank you very much, Dr. Shojania.
Thank you. It was a pleasure to speak with you.
Great.